So self-management is really those tasks that families have to do every day on a day in, day out basis. And when families and children are diagnosed with a chronic illness, they have to incorporate all of those new management principles into their daily lives. So that's what self-management is really all about. There's really 5 tasks that families have to learn to accomplish. They have to work on problem solving, they have to work on decision-making skills, they need to learn how to access resources, they need to take action towards their healthcare goals, and probably biggest is they need to develop a partnership with their healthcare team. And so none of that is easy. It's a large adjustment, and so we're asking families to take on a lot. And we understand that and know that it's a huge task for them. The role of the provider in self-management is really to guide and support families and assist them in the management at home. Certainly education about the disease and the condition, but also education and working with them to problem solve some of the issues. How can we overcome this barrier? How can we figure out a way for Johnny to take his medication? Sometimes it's hard for families to ask providers the questions about how do I manage this at home. I've had families tell me that it can be easier to sometimes write it down. It can sometimes be easier than asking the doctor or the nurse practitioner to ask one of the other team members. I would hope that no family would ever, it would be my desire that no family would ever feel uncomfortable in asking those questions. I think part of the reason we're in pediatrics is that we see the family as a unit, and so we want families to ask us questions. So that would be a key message that I would want to send.